I grew up in Los Angeles, in the suburbs of LA. I actually went to school late. I wound up enlisting in the Navy when I was a young man and served a tour as an aircraft mechanic in the Navy, and ultimately wound up stationed in Mississippi. So when I got out of the Navy, I was able to go to college and ultimately medical school in Mississippi. That's what led me to neurosurgery and my love for neurosurgery and my choice as a career. I've had the chance to work at several really high quality places. And I think it was back in 2015 that I was able to work here temporarily when they were in between docks to kind of help fill a gap and fill a need that they had. And I was able to work with the partners that I have now and with the hospital, the nurses and the staff, and I just remember being very impressed by that. Neurosurgeons treat diseases of the brain, such as brain tumors, vascular problems such as aneurysms, trauma, injuries to the brain and head, as well as injuries and diseases of the spine, the spinal nerves, and the peripheral nerves in the body. Beginning with surgery, the technology that we use in the operating room is cutting edge. We're able to use image guidance that allows us to accurately address any condition. We have guidance systems that function kind of like a GPS system that allow us to know what's inside from the outside and make much more accurate approaches. Likewise, the informatics and the systems that are in place to provide the medical information, the patient's history, the patient's imaging studies, all of the patient's medical records from their past care, they're all available at our fingertips in every room. Well, what I take into the room with me is, the first thing I want to do is I don't want to prejudge anything. I want to let the patient tell their own story, and I want to let the patient tell me what they're feeling and what it is they want me to do for them. Then I can take that information, take the additional things that I have, such as testing or my examination or my knowledge of what I can accomplish, and try to craft a plan for them. To me, the role of the patient in healthcare is to do the work that's necessary to participate in their own recovery. That includes reading, that includes asking intelligent questions, and thankfully it involves the family. The thing that I love most about my job is interaction with people, and that's everybody. That's the patients, that's my colleagues, that's the staff in the offices and the staff at the hospital. I really enjoy being around people, and I enjoy interacting with all of these people. I've got a drawer that I keep memorabilia from things that patients have sent me, and I like to refer to those from time to time, and they really reinforce sort of the gratitude that patients have when you've tried hard, you've done your best, irrespective of the outcome, and they know that you were invested in their care, and they let you know that, and that's incredible. What could possibly be better than a patient coming back to see you in follow-up and telling you how much better they are and how much better they feel, and it's just wonderful.